Often you'd think of your breast as the part that your bra covers, and you're saying that when you do a self-exam that you should be checking, all the way almost up to your neck?
Well, your breast tissue actually starts at your collarbone.
Collarbone, okay.
Goes under your breast, middle of your arm, middle of your chest. So you start by putting your arms in the air as high as you can and look at yourself in the mirror. So you're looking at that whole chest area. That's good, Chris.
Good, Chris. Demonstrating.
I started doing it, then I realized, what am I doing it
We
for?
look like we're doing our aerobics.
YMCA. Okay. We got the Y. Yes.
So your arms are above your head. You're going to turn to the side. Look at the side of your breast tissue, both sides. Then put your hands on your hips and push in. So that flexes your pec muscle back behind.
Yeah.
So the intention there is, if anything's going to pucker up or pull in, you're going to see that, right? So 25% of breast cancers are found in the nipple area. So look at the nipple. Make sure there's no indrawing, that it doesn't pull to one side or another, that it doesn't look different. It doesn't ever have scaling on it, should never have liquid coming from it on its own. Yeah, redness, scaling of the nipple, not good. So if you see any of those things or you question it, make a call to your family doctor.
So anything that you would see out of the normal is what you're saying is right away. Don't waste any time. Go for that call and confirm it. Because obviously the self-examination is not the final answer.
It isn't. But I think women need to know that 90% of the things that we find in people's breasts are okay. So it's getting comfortable with yourself. It's not, cancer is a scary thing. But there's lots of people with, things in their breasts that they feel that are very, very normal.
But better safe than sorry, right? To get them checked out.
Right. But the other thing is, if you feel something, make sure you don't feel it on the other side, right? Check the other side. And if it feels the same over there in the same area, that's you.
That's just the way they go.
How you were built,
That's right. Yeah, and then, keep an eye on it next month, too, to make sure that there's no change there if you're feeling it on the other side, right?
Now, is there a particular way of doing it if once you've done the arms in the air, you've done the puckering, flexing thing? Because I seem to remember from high school, which was quite some time ago, that there was like a certain way that you go like counterclockwise or up and down, or there's some sort of pattern to it.
There's been different ways that have been taught through the years. So if you're doing it and you're comfortable with it, I say to people, okay, it's all about you being comfortable and covering all the breast tissue when you examine yourself. So again, if people want to do this at home, then we say jump into the tub or shower, soap up, and because your hand moves freer that way, use the pads of your 3 fingers, and you start right at the top, right by the collarbone. Visualize your breast like a clock.
Okay.
So you're starting right at 12 o'clock, and you work in a circular overlapping motion, and you're going right towards the nipple. And then you start up at the top again and work around your breast as if it's a clock, right? And then you don't miss any of it.
And you're feeling for
any
changes. Lumps, any changes?
Any changes. Okay. So lots of people have lumpy feeling tissue, right?
Yeah.
And that's just your norm.
Sure.
Or you feel a little area that's kind of tender from month to month, but it's the same on the other side. You know that that's just your norm because it hasn't changed. But if ever it feels hard or that side feels bigger or it looks different, then you call your family doctor.